Vaginismus is just one type of pain during intercourse. There are other people that have vulvodynia or vestibulodynia, dyspareunia, and they are all part of that big umbrella.
Can pelvic floor physical therapy help with things like endometriosis or adenomyosis?
So it all depends. So the reason why I say it depends is depends on your symptoms. If you have pain during intercourse, problems with emptying the bowel, constipation, if you're having pelvic floor related problems, definitely pelvic floor physiotherapy can help. If you also have a lot of abdomen pain, usually by helping with like abdominal massage and desensitization techniques can help with decreasing pain. But one of the things that we can help a lot is with also prescribing exercise or finding the right exercise that can help you with your symptoms.
The next question is, if you have unidentified pelvic pain, is that something that a pelvic floor physical therapist may be able to help you to diagnose or help with, even if there is no diagnosis?
Yes, definitely. But I love the question. So the reason why I love the question is because a good pelvic floor physiotherapist should always clear for what we call red flags. And what I mean red flags are things like things that physiotherapy will not be able to help. So things like problems in your skin, urinary tract infection, irritable bowel syndrome, or recurrent diarrhea, or very low things around the area that are actually not pelvic floor related. But a good pelvic floor physiotherapist should always be aware of red flags and should always refer and make sure that they are clearing that. So rule of thumb, I would say if you have pain in your pelvic floor, the first thing that I would always check is whether you have a yeast infection, a UTI, or a STI. If you don't have those, go for a pelvic floor physiotherapist. They usually are pretty good at clearing all the rest of red flags if you like.
Okay, that's good to know. And someone asked, what is vaginismus and can it go away on its own?
So vaginismus is part of a new definition of pain, penetrative pain, which is called the genitopelvic pain or penetration disorders. And the reason why I actually like that we now have a term that it's like an umbrella for many other terms, because vaginismus is just one type of pain during intercourse. There are other people that have vulvodynia or vestibulodynia, dyspareunia, and they are all part of that big umbrella. Vaginismus is one type of pain during penetration. So in a way, vaginismus is due to, it can actually be two problems. It can either be a pelvic floor that is a little bit too active in such a way that it became quite stiff. So the pelvic floor, not only often the pelvic floor gets stiff, but also the connective tissue. So what I like to tell my patients is that connective tissue is almost like, have you seen like a chicken? And it's going to sound like a horrible example, I'm sorry, but usually it works. Do you know breast chickens? If you put it on the kitchen bench, do you know that they have that slimy thing around? Yeah. So that's what the connective tissue around the tissue that pretty much shapes the muscle around. In vaginismus, that tissue around the muscle is quite stiff. And because it's stiff, it doesn't also help that the muscles are also able to contract and relax completely. However, not everyone has also stiff connective tissue. So sometimes it's only the muscles, sometimes it's only the connective tissue, sometimes it's both. So vaginismus, usually people that have vaginismus have very severe difficulties in inserting a tampon, severe difficulties in having a vaginal assessment, even the finger is too much. So those are the type of patients that sometimes they come to me, and when we are doing a vaginal assessment, this is all we have. And this is okay, this is completely fine. And little by little, they learn and have the awareness to relax, and they are often able to improve a lot with pelvic floor physiotherapy. So I love that you touch vaginismus, because I'm one of the things that I didn't say before about what I do is I'm really, my area of focus is pelvic pain and sexual pain. And this is what I've been doing research on as well. So one of the things that I feel like we need to address is not only like, can we also squeeze and relax, but or can we have pain or not? But I feel like we need to start thinking, stop thinking about pain during intercourse as only like the goal for us to go to physiotherapy should not be to decrease pain. It should actually be about improving and making sure we actually head towards pleasure. So it's not only about squeezing and relaxing. It's not only about having no pain at all, because otherwise we would only numb the area and that would be it. Usually what we want is to not only be able to relax, be able to accommodate a toy, a digit, whatever we would like it to accommodate, but also be able to work towards improving pleasure. So your pelvic floor physiotherapist should also help you to go into that direction. But sex therapists are amazing at also helping with that. So pelvic floor physiotherapists often work with psychologists, nutritionists, and sex therapists exactly because of that.
Yeah, that's great to know. Another question was whether a pelvic floor physical therapist can help where there's pain issues when someone has a vaginal mesh implant.
Hard question. And the reason why it's such a hard question is because it depends. Where is the mesh? Depends on, so for those that don't know, mesh is it's a artificial tissue, but it's not really tissue. It's pretty much like a artificial plastic that they use usually to correct a pelvic organ prolapse or to give more support to the urethra to help it sealing the urethra to prevent leaking or incontinence. And depending on where they put it, if you have pain due to pelvic floor hyperactivity, we can help. However, often the pain from mesh is a lot more internal. It's a tissue that has been traumatized. So often the pelvic floor is like a symptom of something that is coming from the inside. So if mesh, for instance, is giving you a lot of pain around your hip and your hip is hurting because of a protective reaction from the pain, definitely pelvic floor physiotherapy can help, and even physiotherapy can help. But if we won't be able to correct the pain, because we're talking about a tissue that is irritating nerves from the inside. And finally, thankfully, right now, we're starting to do some surgeries to be able to remove that mesh, because, but that means as well that people that did the mesh surgery to correct something will go back to have the problem they had before. Right. So it's a double-edged sword, because I feel like you may not have pain, but you'll end up having the problem you had before. If you had a lot of pain, not a lot of surgeons also remove mesh. Yes. So it's a problem. We don't to make it clear, we won't fix the pain if the pain is from the mesh. We can help with the pain if the pain you're having is a symptom of the mesh, but it's just like only pelvic floor pain. Does it make sense?
Yeah, it makes sense. You mentioned surgery for the mesh, but we also wanted to touch on other types of surgery. So after hysterectomy or excision for endometriosis or some other kind of pelvic surgery, is it suggested that someone work with a pelvic floor physical therapist, and for how long?
I'm highly biased, I have to admit, because of course I'm a pelvic floor physiotherapist. I don't think that everyone needs a pelvic floor physiotherapist after every surgery. I also don't think that it's the same with the whole story we were talking before about avocados. I don't think that everyone needs one, but if you have already a tendency of having pain during intercourse, problems with emptying the bladder or the bowel, and all the symptoms we were talking before, I highly recommend that you even see a pelvic floor physiotherapist before, in prep for the surgery. Because one thing that often surgeries do, and when we talk about surgeries, I always like to add C-sections into it, because I don't think that we often think about C-sections as also it's a surgery, abdominal surgery, but it is. So even like a laparoscopy for endo, we're talking about a surgery that moves, although we often only think about a keyhole, that it's like we only have like some little holes, but it's actually forget that it's major surgery. So there are a lot of things that were touched there. And remember, if you go back into that little needle in the hand analogy, it's the same thing that happens to our tummy. So if we have pain around the abdomen, your abdomen will tighten up. So I remember when I had my surgery, I had pulsing in my tummy. It was just not a pleasant thing, but I knew perfectly well that it was just my muscles like waking up in a way, but also protecting itself from the pain that was the surgery. which is a common reaction. However, if you have a tendency already, if you already had a tendency to have your pelvic floor a little bit more hyperactive, and you have a surgery, well, you have a bigger tendency. In a way, you will feed onto that positive loop to feed that contraction and that increased activity.
People often talk about adhesions and scar tissue that can form after a major surgery like excision. Is like, how does a physical therapist help with that over time, and why is that possibly necessary?
Oh, I love that question because I don't think that we can do it. I love that question because with all due respect, I know that there are some people that really believe that pelvic floor physiotherapists can break adhesions, and I will be honest and I'll say, if we were able to break adhesions, we wouldn't need laparoscopies because our surgeons need knives and lasers to actually cut the adhesions. How can my hands go through the organs and actually be able to cut it? So I actually don't think we can. The reason why people get better, it's simply because we desensitize the area. So we increase the tolerance of the tissues to pressure. And this is something we have been doing for ages. So we don't, to put it clear, I don't believe that we reorganize organs, that I don't believe that we can fix a liver, I don't believe we can make the uterus, I don't believe we can cure prolapse with hands only and visceral therapy at all. I don't feel like we have research on that. We can improve the symptoms, but you're not going to fix the problem that comes from support. I don't believe as well that we can break adhesions with our hands. It doesn't make sense. Our surgeons wouldn't need knives and lasers if our hands could do that. And I'd love to tell you that. But I cannot.
Well, I guess the thing that might be most helpful though is that relief from the symptoms. After surgery, it can take quite a long time to recover, and symptoms can be the main thing that need to be taken care of for a lot of people.
Yes, exactly. And we can definitely help a lot with making sure, for instance, even after bowel surgery, we help a lot, particularly people that have gone through endo surgeries. Often they see their bowel quite affected. We can help with things like helping the digestion to a little bit via just massage, like abdominal massage. It doesn't need to be fancy. It's just really like just helping your bowel to work a little bit better. A pelvic physiotherapist will also help you with making sure you have the right fibers and making sure you're going on urge, which is another thing that I see a lot of people doing, is just delaying their number twos. And if you do that after surgery, it's just a no-no. We cannot just really teach our bowel to just hold on, because the longer they are in the colon, the more water your colon will absorb, because our colon was designed to absorb water. So going on urge and making sure you do all the good things to help your body heal is really important. I think pelvic floor physiotherapists are pretty good educators, and in a way, I hate the word education, but that's the word that we have, sorry. It's just pretty much we give guidance. And I think it's really good before a laparoscopy to talk with your physio, to just tell you things like, are you having the right fibers? If you already have a tendency for constipation, your constipation will get a lot worse after surgery, because you'll also be afraid to put any pressure on your tummy. So things like that are really important, I would say. And I'm biased, like I said, but I don't think physio can do everything, but I think we can definitely provide a really good support. For hysterectomies, usually, first of all, why are we doing the hysterectomy should be the question. Because if we're doing the hysterectomy to cure prolapse, because unfortunately some of our women are sold on this idea, we have to understand that once we remove the uterus, that vault, which is what we call the vaginal canal without the uterus, has to be supported somehow. So we always need to make sure that our surgeon is supporting the vault, because otherwise we can end up having a vault prolapse, meaning that the vaginal canal can also drop. So it's important to understand, first of all, why are we doing the hysterectomy, and what will happen to that vault? How will it be fixed? If we're doing a hysterectomy because of prolapse, probably you should have tried physiotherapy before and just see if pessary and pelvic floor physiotherapy helps. But if it's for other reasons, like too much bleeding and fibroids and other things like that, definitely I understand, or even adenomyosis and severe adenomyosis. If that's the case, definitely pelvic floor physiotherapy can help to make sure that we don't go into either ways, either too tight or too too weak, if you already have a big tendency for weakness, because we also don't want that your pelvic floor becomes too weak, we also don't want your pelvic floor to be too weak before a hysterectomy, because we know that there is a little bit of a there is an impairment of the top support. To put it in lay terms, in a way, if we think this is a vaginal canal, and we think that this is the uterus, there are two big ligaments that are called if we think about this as a vaginal canal and this is the uterus and the cervix is here, there are two big ligaments called the uterosacral ligaments, and they lift the cervix from they connect the cervix to your sacrum. Sacrum is this area here. So this is the reason why a lot of my people that have uterine prolapse, they often have lower back pain. So when you do a hysterectomy, often they remove the cervix and top, meaning that those uterosacral ligaments are no longer there to support. And it's normal that that vault will drop a tiny bit. So one of the problems that sometimes we have is pain during intercourse after hysterectomy, because they may have shortened the vault a little bit. And pelvic floor physiotherapy can usually help to try to stretch those tissues a little bit to assure that we're no longer having pain during intercourse. So I would say it just depends on why we're doing it, how it ended up being. If you have any symptoms, definitely find a pelvic floor physiotherapist. If you're thinking, or if you have booked a surgery, definitely just go and get to meet your pelvic floor physiotherapist. Find the goals. What should you be doing for your own pelvic floor? Do you need any work before? Do you need to work after on something? And as soon as you come out of your appointment in your surgery, make sure that at least you book your after surgery appointment, just to double check. And I know that you may feel like I am biased because I'm a pelvic floor physiotherapist. However, little things like constipation and straining, they can actually be sometimes easily fixed with physiotherapy, just by understanding how you do it and how you should be doing it. You shouldn't need a lot of physiotherapy for you to see results. We usually have 5 sessions that you should be seeing at least some result by 5 sessions. If you're not seeing any results by 5 sessions, that means that it can be the wrong person that is working with you. What I mean by this is, I'm not saying that the physiotherapist is doing anything wrong. I do not know them, but it can be seen. Sometimes we need to find the right person to work with our body. So I would say that it's the same like with doctors. If you feel like your doctor is not really working for you, find a second opinion and get a second opinion until you actually find the right one.